Hey FreeBody Massage family, Kat here in Asheville for FreeBody Massage, and this video is going to show you some really great trigger point release work for the trapezius with your client prone. So it's really helpful to work the neck and upper shoulders, yes, the neck even, with your client prone, because when your clients are face down, they aren't holding their head. Do you ever notice that? Like when you're trying to work on someone's neck and their face up, they might have a hard time releasing their neck because they're kind of trying to hold it in place or hold it in center. When that happens with me, no matter what, if I'm working around their neck and shoulders, no matter what I'm working, I might have them go face down. I might even do scalenes work, all kinds of stuff with them face down. And when a client is kind of holding their head, that's going to activate the trapezius muscle and it will be hard for you to release it. So in this video, you're going to learn trapezius trigger point release work with your client prone. Now it's a good idea to do lots of really yummy warm up, and I did record and post a video on warm up for the upper back and the trapezius muscles. I'll put a link in the description below so you can check that out. And I often work trapezius and levator scapula together. We've been doing a bunch of videos on levator scapula and trapezius, did an anatomy of those two. I'll put a link in the description, and some real specific levator scapula release work, which I'll also put in the description for you. So check out those other videos and watch this one right now for trapezius trigger point release work with your client prone, also getting a really key middle trapezius point. Enjoy, and I'll see you in the next video. Upper and middle trapezius. You feeling comfortable, Miss Jennifer? Yeah. Good. So just a reminder about the anatomy of the trapezius. This muscle is a huge, expansive, superficial muscle. It also is the proud owner of the #1 place in the body to hold tension, to hold trigger points. I'm going to bring this table up a little bit. And so we have trapezius goes from the base of the skull and comes down, is this top part of the shoulder, that right there, upper trapezius. And comes down, attaches to the acromion process on the shoulder, fills all along here over the supraspinatus, over following along the spine of the scapula, over this inferior vertebral border of the scapula. Then it lays over rhomboids, comes down as a V, and goes all the way down to T12L1. So really warming trapezius really does require covering the whole back, getting that all ready to go. And now there are a few ways that you can work with this muscle. Again, it's interesting to try to find, to palpate. So often when we're sort of mining for trigger point gold, we want to think about the orientation of the fibers of the muscle, and then we want to go across the fibers to try to find where we feel things a little thick. But now here's our issue, right? We've got the spine here in the center. We've got the lines of the erectors. We have the rotator muscles deep to the erector spinae group. And then we have like the ribs and the shape and the bumps of the ribs and the bumps of the spine. Like how easy is it to just gently palpate superficially enough that you know that you're only in trapezius, and then differentiating between tension or trigger points in the trapezius itself as opposed to just bumps in the tissue below it? Well, I think that's pretty difficult. And so often when I'm treating trapezius, I'm going to really follow those trigger point maps. And so the trigger point maps are that upper trapezius has a couple points. And then one of my teachers, and one point I discovered way up in the corner. And then across the top and across the top. Okay, so we've got this line, that's upper trapezius, #1 place to hold tension in the body. And then in the middle trapezius, there are a couple of really key spots that we get. And what I find is that if I release those two areas, I pretty much cover the trapezius. I do a lot of soothing. The other parts, the other sections of trapezius are going to release a bit better. And if I really feel a lot of tension through them, I'm going to maybe give some more specific attention to those lower traps. But what I find is that really once I get down into this area, it's very difficult to differentiate between trapezius and the erector spinae group and what's what, you know. So we're going to release 3 points in the upper trapezius along the top of the shoulder. And then we're going to find our middle trapezius point right here. And sometimes we might find another point. Sometimes it's indicated where it's just a little bit on the shoulder blade. There's this little lip of trapezius that crosses over. And then that again is difficult. Is it trapezius where that point is? Or is it in the infraspinatus? Is this a trapezius point? Or is it rhomboids? It's very difficult to know in this area, right? So I just want to give you that information because you might find it frustrating trying to tell the difference. And the fact is the palpation is very challenging, layer by layer. It takes an extraordinary amount of sensitivity, and then you still can't always tell. So this upper trapezius, I'm going to angle myself and just do some really nice, sweet petrissage kind of movement, taking care of my own body mechanics, making sure that I'm just feeling good in my body throughout. And then to locate that upper trapezius, and so here's something, if there's a little too much oil, you can always take the sheet up, lay the sheet over, and you can squeeze through the sheet, and then you don't lose your grip. Or you could just wipe it off a little bit and then come back. Okay. So upper trapezius, we want to follow that thickness of tissue as close to the back of the neck as we can get. You can see here's that upper trapezius tissue. Maybe I use the opposite hand to draw that in. Maybe I squeeze in right there. And I'm just going to keep checking in with my client. If someone has chronic tension headaches, this is going to be a very tender spot, so be mindful of that. This one is not in the Travell books. It's not in most of the trigger point charts. And I learned this from Amber Davies, Trigger Point Therapy workbook author with her father, Claire. So this point they discovered. So how about right there? I'm gonna use this hand to kind of push that tissue up. It makes it easier for me to grab. And Jennifer, how does that spot feel right there?
It feels okay.
Is there any tenderness in there or no?
There is a little tenderness.
A little bit, okay. And so the trick here is to not be in the skin, to be as high up in. I'm going to go a little higher up in that tissue. How about there? Is it a little more tender there or no?
Yes.
Okay. So it's tricky to hold on to, but I'm in just that last little bit of tissue. So I'm really using this other hand. If I do it too much and I hold down here, she doesn't feel it. So I have to ride that line between like being able to hold it and accessing the right layer of tissue. So it's so thin right there, just that little tiny bit right there. Now this one, I'm not going to ask her to move. We're just going to let that point release on its own, because if she starts moving, it's going to kick me off and I won't be able to hang on. Is that feeling any softer? Did it ease up a little bit? Okay. This area of the body, number 2 cause of headaches in the body. Okay, so here we go. I'm just following that flap of the trapezius. Again, I don't want to do the big grab. That kind of feels good, but the trigger points live more toward the very apex of that tissue right there. So I'm going to gather it, use the other hand to help me gather, and then I'm just going to pinch. This one tends to be kind of fiery. How about this one? Is it tender there a little bit? Do you want more or less pressure?
It feels good.
Feels good. Okay. I'm going to hang out there. And then a movement we could do is activating the upper trapezius draws the shoulder and the ear toward each other. So Jennifer, would you do that little bit of activation of drawing the, yep, and slide the shoulder. Yep. There you go. And then just drop. And then do that again. Slide shoulder. There you go. And drop. Slide it back. Maybe a couple more times. Let me get a re-grab there. Great. And just relax there. What I'll be curious to see is that if this release is going to help that shoulder to kind of stay down. And now we're going to follow that upper trapezius all the way out. I'm going to shift sides. Here's a point. Another, often when people get on the table, they push their shoulders down. So when we're working in the upper trapezius, we do want to slide them up. We might grab their elbows and just kind of slide their arms up. That gives us more softness to work with. So now I'm finding all the way at that outer edge. Here's the acromion process. I'm going to bump into it. So I got to just kind of hook into that tissue, use my other hand to help me gather the tissue, and then I grab right on that edge. If someone's having shoulder issues, shoulder pain, feels like deltoid region or top of the shoulder, this is often a very tender spot. And Jennifer, if you could do that movement just a little bit. There you go. And down and up. Perfect. And down and up and down. Let's give that 3 more times. 3 and 2 and 1. Great. And then how's that point feel? Does that feel a little easier? Feels a little lighter? Great. And now as I drag my thumbs across, I actually feel a really big difference in that left shoulder. It's not as chunky. Levator's still tight. We didn't, and chunky, we didn't work on that yet. But that whole top ridge of trapezius now feels a little softer. Does it feel any different to you, Jennifer?
It does feel softer.
Feels softer, right. So that's upper trapezius on that left side. And just do a little down. Okay. And then now this middle trapezius, again, I find really this is such a key point. We find the inferior angle of the scapula, inferior angles down here, superomedial, or that upper medial angle of the scapula. And I put one thumb, one finger along that so I can find those edges. And then I'm going to go halfway between the two. And I'm going to find the very edge of her scapula. And then from the scapula straight across, I find the spine. So one thumb on the spine gently, one thumb on that halfway point, and now I go halfway again in between those two. And usually right there is a fairly tender spot in the trapezius. So I'm going to stack my thumbs, and I have the ability to lower my table. So I'm going to do so that my body mechanics are that I'm 90 degrees to the tissue, my pelvis is lined up behind my work, and now I can sink in. And how's that spot right there, Jennifer?
It feels tender.
Feels tender. Do you want more or less pressure?
It feels good.
Okay, great. And what I have found is that if I release the upper trapezius and don't give this middle trapezius point any attention, I find that can pull that upper trapezius right back into its old tensional patterns. So my focus is in this thumb here. Feels like it's changing to me. It's kind of opening up. My thumb is sinking more deeply into this tissue. Now remember, trapezius is really superficial. So once the trapezius tension eases, pushing in more deeply isn't really going to affect the trapezius. Now I'm just going through it and into the erector bundles beneath it. So typically those are the 4 points in trapezius that I do. I can always glide down along here. I can always roll my thumbs, glide my thumbs down. Some of these spots feel thick to me. Are they erectors or is it trapezius? It feels more like erector bundles to me. And so now we'll do that trapezius work on her right side. So I'm going to step my body in close to the table and just do some nice warming of this upper trapezius, little squeezes. Always checking my own posture. How does my body feel while I'm doing this? If my body's all contorted, I'm not going to be able to continue doing massage work. I've seen so many therapists who blew out their shoulders from working with their table too high, blew out their backs from getting stuck in like a long warrior stance, and then you really can't move, right? So when you're going to do some movement, you just step the legs in a little closer. Right now I'm still, so I just want to make sure that my body is comfortable as it can be. A little petrissage on that upper trapezius. And then remember that upper trapezius, sliding that other hand in can help to gather that tissue. We don't want to be in the skin, but we want to be in that first line of trapezius tissue that we can find. And so that's right there, right in close next to the neck. I find sometimes when I'm working these points, I do a little squeeze, 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 squeeze. And you can play with that. You can ask your client if they like that. Does that feel good? Even after all these years, I'm still asking, does that feel good? Do you like that? Because each person is different. So I don't want to assume that what my last client enjoyed, that this client is going to also. And so now from that first spot, we just keep moving out along the traps. Find that middle section, number 1 place for the body to hold tension. Adjust my body. And then I just want to start right before I roll off the tissue. How's that spot there, Jennifer? Tender spot. You can always let me know more or less pressure. And see if I can get a better hold on it. And then Jennifer, if you would start to right shoulder and right ear toward each other just a little bit. That's perfect, and down. Yep, and just keep going. Great. Great. And sometimes I like to do a nice glide from across the body. We've got one more along that upper trapezius line on the right side. So of course, if she's right-handed, that's going to be a little more tender, a little more stickiness on the side. Well, I won't say it's going to be a little more tender. Sometimes the non-dominant side is more tender because it's being pulled all the time. If most of us tend to tilt our head one side more than the other. And so if we are tilting more to one side, if the trapezius is going to be short on one side and long on the other. Okay. So now here I am as close to the acromion as I can get and still grab tissue. And I get in there and squeeze. And using the mother hand, that other hand to just kind of nurture or stabilize or support drawing the tissue. Both hands participating all the time. Let that go. And now I feel for my break, now we've done a few trigger points. It's always good to just do some smoothing out of those rough edges. And now to find this middle trapezius point, find that bottom corner, top medial corner, and go halfway between the two. And then from there, I go straight across to the spine. So just find that edge, there it is, straight across to the spine. And then I'm going to go right in the middle. Now for this one, I raise my table, I'm going to use my elbow. So if your table's sitting a little high, you can use your elbow instead. So what I'm going to do is start with my elbow real bent without any pressure. Here I'm holding my finger on that spot. I'm going to place the elbow point. And then notice that I place the elbow point, I open the elbow, and then I'm still not really applying any pressure. And then other hand is there just for support. Maybe a little soothing. And then now as I want to apply pressure, all I have to do is bend my elbow more. Lift my hand. It's going to drive my elbow point right into that spot. How's that feeling, Jennifer?
It feels a little tender.
A little tender.
Not bad.
Okay. Do you want more or less pressure?
It feels good.
Okay, feels good. So if she said more pressure, all I would do is bend my elbow more. So I'm going to back off the pressure a little bit. Feel that difference, Jennifer? Mm-hmm. All I did was drop my hand. So now for more pressure, I just start to lift the hand, drives that elbow in. I'm not pushing. I'm not even sinking my body weight anymore. I'm just driving the elbow point more in. It's such an easy, simple way to get more pressure without having to work harder. Ooh, nice release through your trapezius right there. I just felt a little trickle. All right. And then we soothe. Trapezius. Ah, so good.
Such a big muscle. Covers such a great expanse in the back. So we just want to give it lots of loving attention. Now we can check again, just on the inside of the scapula. And what I'll say is that I know that infraspinatus also keeps a point. So here I am at the superomedial angle along the vertebral border of the scapula, just below the spine of the scapula, both sides. That is number one trigger point in infraspinatus. So if I'm sinking in here and they have tenderness, is it trapezius? As I glide down and I come right off, and there's trapezius trigger points here, perhaps. Is it trapezius or is it rhomboids? Hard to tell. But in this area, what I say is go where it feels real thick and chunky, where it doesn't really give beneath your pressure, and just spend a little time there. Give some pressure there. And then do some nice soothing. And take care of your body as best as you can, always throughout your session. And then since the trapezius goes all the way up to the occiput, I'm going to get down on one knee, and I'm going to do some glides up, and then I'm just going to do some circles on this occiput. And no one's really ever going to tell you to stop doing that, because that feels so good. And we're just kind of freeing up some of those connections where the trapezius attaches up at the base of the skull. All right. And that is treating the trapezius with the client prone.